approach the orthodontic treatment when we face treatments that could be complex with aligners, for instance. Aligners is a perfect technique. It's a perfect element that could perfectly substitute the brackets. But in many cases, when especially there are sagittal discrepancies, the aligner is not efficient enough. And in many times, it's not able to solve areas that are very important to solve in a traditional orthodontic treatment. For instance, the relation in between the maxilla and the mandible. To establish a good relation, a functional relation of the occlusion of the mandible and the maxilla, and establish a correct balance of the temporomandibular joint. In all our class 2 cases, normally we find that the disc is shifted forward excessively, the mandible is a little bit retruded, it's a little bit of retrusion in many class 2s, and the position of the condyle is back and up. So our intention in any orthodontic treatment, even if we work with braces, even if we work with aligners, is to establish a correct relation in between the structures. So the motion appliance is an appliance that will help us very much today. I say in this lecture, in this slide, orthodontics is about face, because the orthodontist is a facial sculptor. We sculpture faces, we sculpture profiles, we sculpture harmony of face through the orthodontic treatment, and managing the hard tissues, especially the teeth and the relation of the bones. So it's very important. So as it is important for us, the lower third. Lower third is an extraordinarily important element because we can balance beautifully the nasolabial angle, the supramentally sulcus, the relation in between the nose, upper lip, lower lip, and chin. And Leonardo da Vinci gave us a beautiful distribution on what it should be the correct relation or the ideal relation for a golden proportion of the face, for having a beautiful face, balanced and adequate. So we have to adjust the lower third in these 3/3, that they all should be proportional in order to give a beautiful exhibition of the mouth. So here we have the motion appliance. This appliance that is going to convert the class 2 into a class 1 at the beginning of the treatment. This appliance that is going to regenerate a class 1 scenario just at the beginning of the treatment, and from this point, everything will be easier to solve, especially with aligners, because the aligners are going to be able to solve efficiently the malocclusion of the patient, because they will not have to deal with the sagittal relation, with the sagittal condition. The motion appliance is going to rotate the molars around the palatal root. It's going to accomplish a correct rotation of the molars. It's going to upright those molars, and it's going to protect that those molars are not tipped, because self-engineered collision points on the design of the appliance have been establishing a nice relation in between these structures. So this appliance is having the capacity of uprighting, is having the capacity of rotating, and at the same time moving the posterior segments in a block in a perfect occlusion in class 1. Imagine that we have a case like this, a patient that is an adult patient, 40 years old, 39 years old, coming to the office asking for aligners. We have a patient asking for aligners with this retrusion. A retrusive mandible, 40 years old, has no capacity of growth, because at 40 years old we do not grow. At the same time, we have a patient that is having pain and clicking and obstructed airways. So how can we help in an obstructed airway? Well, the airway of a patient is multidisciplinary. They are fat, there is tonicity, different scenarios of tonicity of the musculature that is surrounding the airway of the patient. So we might have hypertonicity or hypotonicity of the musculature. We can have also anatomical elements. We can have also several aspects, but there is one that is very important, that is when we have a retruded mandible, the obstruction of the entrance of the lower part of the airway is going to be obstructed or narrowed. So by inviting this mandible to be relocated forward, by inviting this mandible to be repositioned in a correct relation, By changing this scenario into this, by bringing this mandible into this scenario, we are going to invite to have the base of the musculature of the base of the tongue, inviting it to be forwarder, inviting this to be forward than it was, and this will bring an open scenario on this part that the orthodontist can help. And only helping at this level, we can really completely upside down many cases that have obstructed airways. Maybe there are other aspects like anatomical or muscular or a peripheral fat on the area of the airway. This we cannot handle it, but the area of the orthodontist we can handle it. This is the point. Whenever, as orthodontists, we can help and we can improve the scenario of our patients, we better do it. So how can we go with aligners from this scenario into this in a short period of time, efficiently and with predictability, with better together? We understand that the aligners are not efficient in the sagittal relation. So if we have a technology that is great, but it's not efficient, what we do? We take what it is efficient, motion appliance is efficient in class 2, we use the motion appliance, we convert the case into class 1, and once we have the case into class 1, everything will be easier and will be easy to accomplish with aligners, short period of aligners. Because aligners, it's a type of approach that is a VIP approach for a patient. It's paying more for a removable and invisible or non-visible or less visible appliance that is an aligner. But the patient is not expecting to have a long treatment. The patient is expecting to have a short treatment. So we have to adjust that as better as we can. So the case is 40 years old, class 2, retrusive mandible, so we pretend to bring everything into the correct relation. How we do? We place the motion. The motion, the motion, class 2 appliance, we have the clear one, and the objective is to place the elastics and convert this case into class 1. Once the case is in a beautiful exhibition of a solid class 1 of molars, premolars, and canines, now this case is much easier to accomplish with a solid, easy, short treatment with aligners. Now what we do is we can remove the motion and we change into aligners. But look at the change. Look at the change that this patient has done in this 6 months of motion appliance at the beginning of the treatment. The patient has repositioned the mandible in a better sagittal scenario. The patient has accomplished a correct occlusion in class 1. The patient now has not overjet, and the patient now, look at the position of the mandible, that has no this double chin because the mandible has gone forward, and this has opened the airway, and amazingly, in this particular case that was having pain and clicking on the jaw, this has disappeared. And why has disappeared? Because we have been inviting this mandible to bring forward, and the disc that is inside of the relation, the disc that is inside that was being painful, now is released. Remember, when we have a class 2, the condyle is back and up. This is stretching the posterior ligament, with this is sending the disc forward. The disc and the temporomandibular area in this distal part is where the vascularization and innervation is, so is the painful area of the joint. So what we pretend is to invite this and generate an invitation to distract the condyle, release the space, and spontaneously release a space for the reposition of the disc. Once we accomplish the class 1 platform, the scenario of the condyle, the scenario of the joint is completely released, is completely balanced.
As long as I can remember, I've had a clicking in my jaw. So when I eat, it's quite a pronounced click and quite painful at times. My top teeth were in front of the bottom ones, and the jaw was receded. So the intention of the treatment was to bring the jaw forward and the teeth back. From starting the treatment, I was kind of conscious that my jaw had stopped clicking, because especially with something quite tough to eat, like toffee for example, it would click quite loudly, and it was painful. It's hard when I noticed that there was an improvement, but it's almost like one day you realise, oh, that doesn't happen anymore. I'm not not waking up in the middle of the night, short of breath. Probably related to sleep apnea-ish, and that seems to have gone. That's why I mentioned it as being a positive thing.
No double chin. So this is what we want. Balance the relation. The patient has grown? Absolutely not. But the patient has a new relation in between the mandible and the maxilla. And amazingly, we have a solid and consistent occlusion on class 1 of canines, premolars, and bicuspids. Now, what we can do is to remove the motion. To give to the patient 2 vacuum invisible retainers to be used 12 hours a day until we receive the aligners. And then we place the aligners. So how many aligners did we receive? 28 aligners. We submitted this particular case to Invisalign at that time, and we received 28 aligners. So the interesting point is that when you deal with the spaces, when you have spaces in between the incisors, the amazing part is that we can change aligners every 5 days, and they will not lose track, because they are going to have a magnificent efficiency, because what it is easy to solve are spaces. So this means that we were changing aligners every 5 days, and it was 4.5 months of aligners. This is what we expect, to generate an scenario of class 1, to accomplish a class 1, and to generate a scenario in which we are able to solve the class 2 with a short treatment of aligners. So this is the scenario that we accomplished, in which the patient now is much nicer. But we did an experiment. We submitted again the case to Invisalign again from scratch with the class 2. And what happened with that? That at this point, we received an option to treat them only with aligners with 83 aligners. So imagine, instead of 28 aligners, we were having an option of only Invisalign or only aligners of 83 aligners. And amazingly, this option was only focusing distalization, was not inviting the mandible to be repositioned forward. So if we establish a class 1 like this, and we do not invite the mandible forward to release the temporomandibular joint, what will happen is that when we bring this back and we accomplish class 1, if it is possible, when we accomplish class 1, we will generate a chronic problem of the temporomandibular joint, because we are locking any future possibility of inviting this mandible to be repositioned forward and releasing the stress on the disc position. So this is very important. So imagine that these 83 aligners were focusing the attention on dental. And orthodontic treatment is not dental. Orthodontic treatment is facial, is functional, is airway, is temporomandibular joint, is occlusal, of course, and all those aspects. So look at the difference with the class 1 accomplished with the motion, or moving the posterior segments one after the other and generating a chronic problem of the temporomandibular joint. Those are the difference that we're talking about. So how many aligners we accomplished, or we were able to save to our patient with emotion? 62% of number of aligners in relation with the only aligner treatment on this particular case. Better Together is a great solution. I would say is the solution for the sagittal problems of class 2 or class 3 when we work with aligners. And this is going to clear the space, is going to clear the complexity of the case, and will give us the possibility of expanding and opening the span of treatments that we are able to accomplish with the invisible technology. Imagine a case like this, a case like is retrusive, a case like is 14 years old, a case like does not want, imagine that she does not want aligners, does not want braces, so is asking for aligners. Can we treat a case like this? Can we jump in a case like this? Well, if we want to do it dentally, will be a mess, because we will destroy the profile of the girl. But what we need is to invite this mandible to relocate forward. But this is a super class 2, super overjet, super class 2. Can this be handled with aligners? Of course we can, but we have to do it better together. We start with the motion, we place the motion, and we accomplish. This is 4 months after, 2 months after, and 4 months after we accomplish super class 1. Now we have a solid occlusion in class 1. Now we have beautiful spaces. Now we are able to finish this case either with brackets or with aligners. But amazingly, we have converted a case that was impossible to be solved with aligners in a case that is absolutely easy to solve with aligners or brackets. This is the difference. When we are working in the office, when we are having complex cases and patients want a system that is without braces with aligners, the question is, can we approach almost every case with them? If we hybridize, if we use technology outside of the aligner, yes, we can. So we have the motion that will help us into the correction on the sagittal relation on this particular case. Look at the difference of the position of the mandible in a case like this. Now is balanced. Now the structures are correct. Now the position of the joint is adequate. Now everything is in a correct relation. So this is what we want to accomplish. Now the airway has been expanded because this breath forward of the mandible, it's opening the airway. And the importance of the airway for those cases that we find today that they are really obstructed and we can help. The orthodontist can help. Of course, it's multidisciplinary, but if it is a multidisciplinary approach, the airway of the patient, shall we forget about the importance of which is the portion that the orthodontist has to help to the patient on? Because we are not going to solve the 100% of... No, the orthodontist has to focus and try to solve the portion of the airway that is able to solve. It's our responsibility. It's a medical specialty. We need to increase the health of the patient, and this is one of the most important things and of public health that we have in the world, no, and in this scenario. In this scenario, here is the girl finished in a good relation. All right. All with this retrusion, with this mandible retrusion, and with this length of this upper lip, when we have an upper lip that is long, there is not a balanced profile, because remember, Leonardo da Vinci was giving us a proportion that the upper lip has to be 1/3 in relation to the lower lip and the menton. So this is too long for this too short a scenario, and we want to shorten that. Can we shorten that with orthodontics? Of course we can shorten that. This is the scenario of the patient, full step class 2. But we place the motion, and with the motion, in 5 months in this case, we accomplish a beautiful occlusion in class 1. Now, this case, with those spaces, with this overjet that has been reducted because the mandible has been repositioned in the correct position, now this case is easy to solve with braces or with aligners. So this is what we need to convert a scenario in which we are able to solve with braces or with aligners. So this is what we do. So 5 months later, we accomplish. So now we can end up this treatment. But look at the difference. The mandible has been brought forward. This is a scenario of occlusion, and the most important thing, a good relation. If we compare this with the proportions that Leonardo da Vinci was giving us, we will see that at the beginning, this case was too long, the upper lip, and this case was too short, the two lower thirds. Now, by releasing pressure without extracting teeth on this particular case, we in the upper lip and we balance the 3/3 of the face of the patient. And this is very important, but another thing is that we invited this mandible to go forward, and this airway that was narrow now has been expanded on the area that the orthodontist is able to work. So this will be very helpful for what? For playing tennis, for instance, because the patient has a correct airway relation. Here we can see the patient with the mandible in a good relation, in a good position, in a balanced relation. So I think that we are good. Thank you very much for your attention, and feel free to come in first hand. Thank you. Thank you.